morning and good afternoon, everyone, and welcome to Roche and WAN IFRA Science in the Newsroom Masterclass. Let me introduce our lead trainer for this session, Craig Sir Kwan Kane, founder of Data N. He has been providing data journalism training and consultancy to media in Asia. He has more than 15 years of experience in digital journalism and used to work in several newsrooms, including Visualisation, NBC, and PRI. He is also the competition officer of the Stigma Awards, an international awards for data journalism. Without further ado, I'm pleased to invite King to kickstart our first session. Over to you, King.
Thank you very much, Jen. Today we have about 1 hour. So what happened is that I'm going to share with you some very practical tips, tools, as well as a very short live demonstration of how we can make chart using some health data. All right. But before I start, I would like to share with you where you can access this slides. All right, let me just go to I think I put the link in the chat box. Let me just get that link for you. This is a share folder, and inside the share folder you will see a PDF file, which is the slides that I'm going to present today. And there's another spreadsheet or Google Sheets, that with some data that I'm going to use to make a chart later using a tool called Data Wrapper, right? So let's start to talk a little bit about data journalism. Okay, I'm going to skip my introduction. Yep, so today we're going to cover very briefly, what is the purpose of data storytelling, right? I assume all of us heard about data journalism. So I'm not going to tell you what is data journalism, but I would like to remind you why we use data in storytelling or in reporting. And after that, we are going to look at different approaches to engage readers with health data, right? I have compiled several stories about using health data, especially, there are a lot of very good data-driven reports during the pandemic. So we are going to look at them and see what kind of lessons we can learn from them. All right. Then I'll be briefly talking about, when we are working with health data, what are the things that we should pay attention to. And eventually, the last part would be, I'm going to do a demonstration of using a data visualization tool called Data Wrapper to make a very simple chart using the data that is in the share folder. All right. If you have any questions, you feel free to put your questions in the chat box. Right, I am looking at the chat box while I'm presenting, and I'll stop from time to time to respond to some of the questions. All right, very quickly, data journalism in a very short definition is journalism done with data. But to be more specific, data can be the source of data journalism, or data can be the tool that helps you to tell the story. Or sometimes it can be both. So think about two things here. Data can be the source of your story, and data can be a tool to help you to tell a better story. And sometimes data can be both in your story, both as a source as well as a tool, all right? And when we're talking about doing data journalism, it means that, the processes involve, some of them including the gathering of data. If the data has some typos or what we call dirty data or messy data, we need to do some cleaning. After that, we can start to organize the data and analyze the data, charts, maps, or infographics, and publish it for the purpose of journalism. So data journalism is very different from other kind of data works because, most of the time we use data to make business decisions. We use data to understand our readers' behavior. But in data journalism, data is used to support journalism, right? To better inform our audience and readers. But why do we use data? Just now, I gave you the definition of data journalism, what are the processes involved. But why newsroom, especially a huge one like New York Times, Washington Post, South China Morning Post in Hong Kong, why are they investing so much in data journalism. Because data journalism, right? I would like to quote my friend Eva Constanteras. She's an international data journalism trainer and consultant. So she has this very good quote that I agree a lot, right? She said that, data journalism is harnessing data, using the power of data to measure a problem. So we want to know how serious a problem is, okay? And we have to measure a problem, and data can help you to do that. So not only that, data can help you to identify who has been impacted by the problem. Sometimes it tells you what is causing the problem, and sometimes it can even tell you what are the possible solutions, okay? So we used to talk to, when we are trying to measure something or find causes and solutions, the traditional way of doing that is to talk to experts. But in this case, we are going to look at data and trying to figure out, from the data, what can the data tell us about who has been impacted, what are the causes, and sometimes what are the solutions, and data can do that. So what is unique or special about this approach is that this is a very scientific research-based methodology, almost as if we are doing a scientific research. We collect data, we look at data, we analyze the data to answer our questions. And this approach, right, it is trying to uncover the root of the problem and not just reporting the existence of a problem. Right? So a lot of time we like to report about a problem, like, this is a problem, how serious it is. But sometimes using data journalism, it is able to help us to uncover the root of the problems. And as I mentioned just now, sometimes even the solutions. So let's look at some of the health reportings that use data as a tool. So this is a story. This is a story that I did 5 years ago, 2017. On the slides, you are able to see the links to this, the URL to this story. But the live story, the live version of this story is not well maintained, because I have left PRI the worlds, and I think they have migrated their servers. So the graphics, the data visualization doesn't really work as expected. But I have a video recording of the working, the good version of the story. I'm going to play it. This is about HIV rates in South Africa. And I used data to make a opening of the story to show the global scenario of HIV incidence rate, as well as why we need to focus on South Africa, right? So let me just play this animation. So first, I show that the global HIV rates, right? You can see that it has stabilized over the past 15 years. Okay, and then I tell you that almost half of people living with HIV live in East and Southern Africa. Oops, sorry. This is the storytelling treatment. You have to keep scrolling, and then you will see more information. And then I go from the global scenario into Africa, and into 3 countries in Africa. And you can see that these 3 countries have made significant improvement over the past 20 years. Okay, but the rates don't show the whole picture, because if you look at South Africa, the rate is not going down. You can see that it went down a little bit in the early 2000s, right? But it is like coming up again in 2015. So just play the video one time so that you can look at how data is and visualization is used in this story to tell to set the global scenario and to explain why this story focused on South Africa. So this is a way, that you can always use data to show the bigger picture or context. I think a participant raised your hand, right? Just now I saw the notification. Who is that? Do you want to say something? So from Africa, I don't just stop at Africa, but I look at, between the young women and young men in Africa, South Africa. And you see that the rate is much higher among the young women compared to men. And the whole story is about HIV disease among the young women in South Africa. So we use this data to show the big picture before even we start, to tell people why, what is happening in South Africa, because we use the data to set the scenario that, why we are looking at South Africa and why we are looking at young women, because data have shown us that, the problems are still, very significant or serious among this community. So that is why we use, a data to set the scenario. Another story that I would like to show you, this one I can show the live version, is a story by Continentalist, which is actually a data production house or a data studio based in Singapore. They have done a story together, with the Doctors Without Borders on hepatitis C in Asia. So this, again, is a very data-driven story. I encourage you to have a look after the workshop. So first, it tells you, it again use data to set the scenario, like why we are looking at, why we should care about hepatitis C, because hepatitis C is one of the infectious diseases that cause a lot of fatalities in Asia, right? However, if you compare to malaria, HIV, TB, and cholera, right, it is considered, in the middle. So comparing HIV with hepatitis C, and a little, infographics of how the disease can spread. After that, they actually use data to look at, why the disease, is so hard to be eliminated in Asia. Okay, so one factor that they identify as the inequality. Actually, it means, that the treatment or the drugs are very, very expensive, by Asian standard. And here they use data to tell you how much, different drugs cost, right? So from here, they're able to identify that, for some very effective drugs, right, it costs 24,000 USD, right, for a standard course of treatment. So obviously, this price is out of reach especially in developing countries in Asia. Okay, then they from the global and from the inequality, they zoom into different countries. For example, Pakistan. So they look at the situation in Pakistan, how many people were screened, and out of the people who were screened, what is the age group, right? So remember that I say that we use data to see who has been impacted, and this is a typical case of using data to see, how the disease, how the problem, is doing among different age groups. How many of them are put on treatment, and how many of them completed treatment. Okay, so give you a picture about what is happening in Pakistan. Then they go into, personal profiles of some of the patients in Pakistan, and the challenge they face in seeking treatment for their hepatitis C. Right. This is not about data, but later I will talk to you about humanizing data. Data story shouldn't be just about data. It should has human elements, right? Because you are still telling stories, and data sometimes can be very cold to a lot of people, right? They don't feel it. But if you put it in human stories together with data, right, that usually makes your story more engaging. After that, they look at Bangladesh, and Bangladesh, they look specifically at first they look at Bangladesh. They look at the Rohingya refugees in the Cox's Bazar refugee camp. All right. So the same approach, look at the numbers. And this is interesting. They look at what is happening in the camps, and they're trying to figure out why seeking treatment is so hard in the refugee camps. And I'll just scroll it. First they show you there are two main roads, okay, crossing across the camp. And where are the clinics, the location of the clinics. And there are two hospitals that provide treatment for hepatitis C. But for different, if you are at different areas in the camp, to travel to the hospital, right, it takes a long distance. For example, 4.9 kilometers, 4.8 kilometers. Then they zoom in to tell you that from here, if you want to walk to the hospital, it'll take you 1 hour by foot. So the accessibility of health treatment is a problem in the refugee. And it was made worse during monsoon season, right? And then they have another part about how some countries are trying to solve the problem of very expensive drugs by challenging the big pharma, right? And again, you can see that how they simplify the model of care. Before this, it took 140 days. Again, these infographics of showing the pathway to treatment. After that, they simplified it to just 7 days from 140 days, right? So these are some of the alternative, that can be also used by other countries, right? So then talk about unequal access to healthcare, okay? Right, so that's the end of the story. So for me, this is a very good story of using data to show the scenario of the disease, okay? And not only that, but also use data to identify some of the causes of the problem, right? Inaccessible healthcare, very expensive drugs, and in some areas where access to hospital, it's it involves very long distance of travel, right? After looking at the story, data is also very useful to explain complex health issues. Sometimes when we want to raise awareness, we need to explain to our readers, how you can protect yourself from certain diseases, right? And sometimes to explain those kind of, medical process, right? How virus evolve, how virus spreads, things like that, could be very hard to be done through text. So in that case, data visualization can help us simplify it and help us to present these processes, right, in a much simpler form. So if you still remember when the COVID-19 pandemic started 2 years ago, 2 years ago, it was very confusing, right? We did not know much about the virus, people were panicked, and there were a lot of misinformation going around, spreading just fake info, misleading info, right? So a lot of newsrooms have actually done a lot of very good explainer to explain to people what is the disease, how the virus behaves, and how you can protect yourself, how we can protect our society, right? So these are some of the stories that I think are very good. The Washington Post has a story to use this kind of, let me just, need to scroll to start the animation. To use this kind of very simple data visualization to show how the virus spread. It is a simulation, okay? And it then compare with what happened if there is a quarantine, right? So I'll just skip this. This is for measles, Ebola virus. So it compares COVID-19 with different viruses. Yeah, here. When we have quarantine, then we are able to stop the spread of the virus, right? This is part of the very early, reporting when we did not know much about the virus, and people were still disputing about quarantine and the lockdown in China, if you still remember that, right? Another story is this, also by the Washington Post. it is trying to explain what does it mean by flattening the curve. Remember that when we first, during the very first phase of the pandemic, a lot of governments keep talking about, medical experts keep talking about, oh, we need to flatten the curve. What does that mean, right? For a lot of people, but then it was very confusing, right? So remember that this was done in year 2020, March 14, right? At the very, I think the first month of the pandemic. So this story used the bouncing dots to illustrate or to simulate, right, the different scenarios, right? The first one is free for all, which means that there's no measurement, there is no measures taken to stop the spread of the virus. And this is the curve of the infections over time, okay? Then the second scenario, we don't have time to finish all the simulation, sorry. The second scenario is that when there's a quarantine, but that quarantine after that broke. So it is like partial quarantine. And what happened? And you look at the curve, okay? The third one is we have a, partial, social distancing. People don't move or keep distance, which means that you don't, avoid going out. So you can see that less people are moving, and that will stop, that will reduce the spreading of the virus, and you'll produce a much lower curve. Then this is like a total lockdown, right? Only essential workers are allowed to move around. And you see what happened in this scenario. You look at the curve, okay? And then you can compare the 4 different scenarios, right? Free for all, this is business as usual. This one is attempted quarantine, moderate distancing, extensive distancing. So in these 4 scenarios, it explained to people why we need to, have social distancing, why we should avoid going out, right? So it is a very easy to understand way of presenting a very complex issue, and also a very engaging way because it's very visually driven. And guess what? This story is the most visited story in the history of Washington Post online website. Okay, it has very high traffic. This story, I'm not sure what is the number, but this guy Harry Stevens, after he published the story, he was invited to talk and to present in many conferences and events about how he came out with the idea and how he produced this story. Right. So again, I know that pandemic is, we have been in the pandemic for 2 years, by why are we still keep visiting the pandemic stories? Because during this period, this two years periods, right, some of the best data-driven stories on health reporting are related to COVID-19. Right. Another story that I want to share with you is, how we can humanize the data. As I mentioned just now, if your story is full of data, sometimes it can be boring, okay? And if you don't have very good visual to go with the story, one way of making sure that your story it is still engaging is to put a lot of human stories in your story. So let's look at this story. This is an award-winning story by New York Times. So it is a data-driven story, but at the same time, it combines with the stories of 2 kids in the city of New Delhi in India. So what happened is that the journalists, they work with a technology company that produce air pollution detectors. Those are mobile detectors that you can bring around with you, right? So they attach they asked these 2 kids to bring the air pollution detector with them throughout their whole day of their daily routine, and the detector keeps collecting data throughout the whole day, and then they compare the exposure of air pollutions by these 2 kids based on the devices, the detectors, right? And these 2 kids are from very different background. The boy is from a poor family, and the girl, she's from a much wealthy family. So the title is Who Gets to Breathe Clean Air in New Delhi. It was published 2 years ago, almost 2 years ago. So you can see that they show you a lot of videos of their daily lives, And at the same time, they tell you that when they wake up in the morning, how much of air pollution exposure, they receive, both the kids receive in their house. And how this is their neighborhood, their houses on the map. And when they're getting ready to for the school. And this is the air detector that the two kids bring with them the whole day. Right, and then they plot the data. They want to find out, what is the gap between a wealthy kid and a poor kid in New Delhi, and then what is the gap between them in terms of air pollution. Right, so you can see that there are human stories of kids. There are good videos showing their daily routine. There are also charts that shows data. Okay, this is how they go to school. Their schools, the house from the house to the school, and in the school of the rich girl, there's actually a large air filter in the basement. This is how their school condition look like. And then they look at further into the day, what is the data of the two kids. All right, so I'm just going to scroll to the end of the story. Yep, and this is the end of the day for the two kids. Okay, and of course they have a long part about their methodology, how they collect the data, who they work with, and things like that. So this story, why it makes it so good, is because that yes, it is a data-driven story. It used data to measure the gap between the two kids, right? As a representation of the wealth and health gap in New Delhi, India. But at the same time, right, it doesn't show you just data, right? First, it picks a very interesting story, which is the story of comparing two kids. And secondly, the way they present the story through video, right? And, a little bit of data visualizations, right? That's what makes it so engaging. At the same time, very convincing because data is used, right? Next, I want to share with you how we can personalize our news content using data. So remember, these are some of the techniques and approaches that we can use to engage with our readers and to make our story, especially health reporting, more friendly to our readers. Okay, so just now we'll look at how you use data to tell a bigger picture, how you humanize the data. So now we are looking at personalization with data. This has been made quite popular during the pandemic, because the pandemic, we depends on the COVID-19 data on a daily basis to manage our lives, right? Whether we should go for vacation or not, where should we go for vacation? Should we send our kids to schools, to kindergarten, right? Should we dine in restaurant, right? All this decision we make based on the data announced by the government every day, right? And in order to make the correct decision for ourselves, right, we need very granular data, which means data not just about the whole country, but data about our own neighborhood, data about our own district. And these are some of, this data are made personalized. They are also made easy to access by some of the news organizations. Sometimes they do a much better job than the governments, right? The governments are the one that collect the data and distribute the data, publish the data. But how do you make the data easy to use and relevant to different individuals? That sometimes it falls on the shoulders of journalists. So here's one story published by the New York Times. How full are hospital ICUs near you, right? So there's a interactive map. I think most of you have seen this kind of application before. You put in a location. For example, I used to stay in Queens in New York when I was studying there. and it will tell you, like all the hospitals there and which hospitals are full. You can see red color means that it's almost full, is 94%. Red color, yellow color is like moderate, moderate level. So you are able to see how what is the medical situations in your neighborhood, right? There's another story that I won't show here, but this is done by BuzzFeed News. You can get the links, the URLs of all the stories in the PDF that I share with you. And this is very typical, right? You put in where you live or your postcode. It tells you how many cases of COVID-19 in your neighborhood, right? So think about it. I show you COVID-19 stories, but the same techniques here, the same approach can be done for other diseases. For example, you can use this, for hepatitis, HIV, TB, cholera, a lot of different infectious diseases. It applies very effectively on infectious diseases. Why? Because people care about because the disease can infect right within a community, so people want to know how many cases in their own community. For example, in Malaysia, after the wave of COVID-19, we're having a wave of hand, foot, mouth disease among the kids, right? So the parents are very concerned, whether they should bring their kids out, whether they should send the kids to kindergartens, right? So if you're able to get local data about how many cases in each neighborhoods or counties or districts, right? And you're able to make this kind of application, it is very helpful for a lot of parents to make their daily decisions, all right? So this is, again, some approaches that a very effective approach that has been used by many news organizations, and it can be used for other diseases as well, right? Oops, let me show you another. And this is another one that I like a lot. This is another types of interaction that you can use with data to interact with your user, right? And this is, what we call, draw your own chart, which means, if you are trying to engage your readers or get your readers' participation in a story, one way of doing that is this. So let me just show you one story done by New York Times. You draw it just how bad is the drug overdose epidemic. Okay, it was published in 2017, so 5 years ago. So it has several charts, and asks you to plot the charts by yourself. So you can draw the charts. So for example, who die every year from car accidents. I just guess anything. It shows you the real numbers. And then who has died from guns, right? Probably there are many more in the recent years, I think. Okay, I overestimated it. HIV, I think it's quite low now. Okay. And drug overdose, I know that it is a huge issue in the US right now. So I can adjust my line. All right. Yeah, probably like that. Oh, wow. It's much higher than I thought, right? Then it shows you all the, through the actual data and how is the drug overdose situation in every county. So why do they make this? So this is very useful when there is some elements of surprise, which means that something that is, that is very different from what majority of people believe. If you use this approach, right, it could be very effective because your readers would be taken surprised by the real data. For example, this one, I plotted here. I thought it's like, okay, I know it's serious, but probably it's like this serious. But then the actual data shows me that it's much serious than what I thought. So this is a good way of challenging the initial thought of your readers, and also helps them to remember the situation or remember this report because they have participated in your story. They make a guess, they got a number wrong. So this will leave a stronger impression in their for them, and also it encourage them to read further, because this was like, oh, this is very different from what I thought. And when you are proven that you are wrong, you want to find out why, right? And that is when you will have more incentives or more motivated, right, to read the whole story. So that is a way to engage your readers using data. So the good thing is that this chart is now available on Flourish. If Flourish is a data visualization tool, I will show you later. If you subscribe to the enterprise plan, you are able to get a template to make this kind of chart without any coding, okay? But you need to get the enterprise plan, right? But try this, right? If you are a non-profit newsrooms, probably if you write to them, they might be able to give you a free enterprise plan, or you just tell them that we really want to try with this, draw your own chart approach. Can you give us access to it? Probably they might be able to do it. I don't know, but what I know is that now there's a way to make this without coding. All right. All right. So those are some of the approaches that we can use in health reporting. All right. It doesn't have to be boring. It doesn't have to be all about numbers. If I just show you just now, it could be very interactive. It could be very participatory. All right. Then the next topic that I'm going to share with you is when we are working with health data, these are some of the things that we should pay attention to. Okay. So I'm going to go through this. First, whether you're working with health data or other kind of data, always read the metadata or the data dictionary. What is metadata and data dictionary? Basically, it explains the data that you got. It tells you the definition of the data. It tells you the limitation of the data, right? So when you get data and when you think that you don't fully understand the data, always approach the data owner, right, and ask, do you have a metadata for this data set? Or do you have a guideline or a manual that I can read to understand about this data set? Always do that, right? Because you want to find answers from some of the questions here, okay? So just go through it one by one. First one, who collect, own, and manage the data? This is very, very important, because you don't want some people with conflict of interest to come up with data that that makes them look better or make their competitors look bad. You get what I mean? For example, I give you an example. A telco company might hire another research company to do a survey about which telco company in the country provides the best coverage of Wi-Fi, right? For example, and the results came out showing that, oh, this telco company is the best company, so-called best company, right? And that this is not a good data set to use because it has conflict of interest, right? Because the companies that hire or commission their survey or the study, right, turn out to be, turn out to look very good in the result of the survey. So be careful about this. Always, find out who collect, own, and manage the data, and to see whether they have any conflict of interest with the subject of the data, right? Then the second question is, why is the data collected? What is the purpose? Okay, you want to know this because if the data is collected for some commercial reasons, they might be biased in the data, right? Which means that the integrity of the data is not there. And if that is the case, you might want to consider again if you want to use the data or not. Okay. How is the data collected? This is about the methodology. Okay. Is the data collected by asking people or by estimating using some kind of simulation or formula, right? So if when you understand the methodology of the data, you're able to find out what are the weaknesses and the limitations of the data. So if there are too many weaknesses or too many limitations, right? For example, a data that shows you some opinions of the public, only interview 100 people, for example, right? And it claims that you represent the whole countries. You know that the data is not very reliable because the sample size is too small, for example, right? So understand about the methodology will help you to decide whether the data can be used or not. Another very important question is whether the data is consistent from time to time, any change of definition or methodology. Sometimes we want to look at data that goes back, for 10 years, 20 years, right? But sometimes it could be problematic because especially health data or scientific data, right? Because sometimes the definition of the data has changed. Sometimes the methodology to collect the data has changed. And because of those changes, it affects the results. So if you use those data and you compare, the data now compared to like data 20 years ago, but actually these two data points are collected through different methodology, it might not be fair to compare them, right? So sometimes you're not experts in those technicalities, right? So in that case, sometimes you might not be able to answer all these questions, even though you have access to the metadata. So in that case, always talk to the data owner or experts in the topic to help you to evaluate the quality and the integrity of the data. Right? So don't just based on everything that you got online and you just go to publication. Okay, this is before you even do any analysis, right? You need to make sure that the data that you got is of highest quality and integrity. Okay, and the last thing is that try to find out is there another source that collects similar or parallel data. Parallel data means that same data but collected by a different party, and probably the results are different. Compare them and then pick the right one, and also to find out why are they different, right? So these are some of the tips when you are dealing with data, especially with health data. Let me see if there is any questions in the chat box. I don't see any. Okay, so let's continue. Here, I would like to share one health report by the Economist Impact, which is, I believe, is one of the unit in the Economist. And this report is supported by Roche. And this is a report about several different different diseases in Asia Pacific. I believe there's a link. Yeah, there's a link to the report. I'll just put that in the chat box. Okay. And the focus of this report is actually to highlight the gaps in healthcare system in 4 countries: Indonesia, Philippines, Pakistan, and India. Specifically in the infectious diseases, right, including hepatitis B, HIV, TB. I think these are the main diseases, right? So whenever we receive this kind of report, right, there are several things that actually we can do, right? I'm going to open that report now and to use that as a example. I'm going to open the PDF version of the report. All right, so this is the report. Of course, from the report, right, usually they will have some data. So if I just scroll down, you'll see that there are some data for each country. Not this one. Page 22. Yeah, so there's some data about HIV in India, there are also data about, TB in different countries, in India, Pakistan, Indonesia, Philippines, right? And so from here, there are data, right? So what I usually do when I, want to report when I think that a report is worth reporting on, I would reach out to the report author or, the organization that published the report and try to get the raw data from them. Because with the raw data, then I'm able to tell a better story and probably to have a more focus on the country that I want to report on, right? So from here, I approach the organization, and I was able to get access to the data that they use in the report. Okay, so I've shared with you this spreadsheet in the share folder. So now let me just get the link again and put that in the chat box so that everyone can access. If you want to have a look at the data that I got. So you see that there's an original data. This is the original data that I got right from the report publisher. Okay, and I reformatted it because I want to make my own chart, right? So the next session, I'm going to show you how I make the chart. But before that, let's take a look at the report again. So this data is actually showing that, India has missed the 2020 target set by WHO. Okay, so the target is to reduce the TB incidence rate by 20% from 2015 to 2020. And in fact, the reduction during these 5 years in India is only 13.4. So it's much lower than the target set by WHO. And the same for TB mortality rate. The target is to reduce by 35% in the 5 years. But what happened in reality is that they reduced by they did not reduce it. They increased the mortality rate by 2.8%. Okay, but you look at the numbers here, now I explain it, you understand it. But if you look at this infographic or this chart, right, it is probably not the best chart to illustrate the difference between the target and the real situation, right? So like this, I don't know how you call this, like this circle here, right? How do you read this color and this color, and where is the 20% and where is the 13.4%? And what about this one, right? So it is probably not the best chart, to present the number. So what I'm trying to do is that I would like to reproduce charts that makes it easier to read. Okay, so for this data, there are 4 countries: India, Indonesia, and then you have Philippines and Pakistan. All right, you can see that the same chart appears again for Indonesia, and if you scroll down, the same chart appears again from Pakistan and later for Philippines, right? But again, usually when I want to republish a report or I want to do further reporting on the findings of the report, of course I want to use the data, but usually I won't just copy paste the chart here, especially when the chart is not the best chart, right? So I would prefer to produce my own chart. And this is where I want to introduce to you a very good tool called Data Wrapper. Okay, so there are 2 tools here that I highly recommend on data visualization tools. These are the tools that don't need any, they don't require any coding skill, and these are free tools. Of course, they have like premium accounts that allows you to do more things, but the free accounts allow you to make all the basic charts. All right, I think many people probably know about Flourish. It is very popular in the past few years. Okay, if you work with the newsrooms, you're able to get a premium account, a free premium account for Flourish. Right, just go to their website, and then there's a form that you can fill out and get a free account. But even if you don't get the free premium account, just use the public free account is enough for you to make a lot of charts. So I'm going to skip Flourish. I'm going to focus more on Data Wrapper. Data Wrapper is another tool that allows you to make free charts using data. I especially like their maps because they have many more mapping templates compared to Flourish. Okay, so if you want to make maps, Data Wrapper is a better choice. And also Data Wrapper has some very useful charts templates or charts types that are not available on Flourish. So that is why I'm going to use Data Wrapper to make my chart today. Okay, so I'm going to do a live demo now. Go to Data Wrapper. So here you can see that there are different pricing. You don't have to go for the custom or enterprise. Of course, if you want, you can go for it. But for me, I only use the free account, and that is actually quite sufficient for me. So I'm going to go to my account. And you can see that these are all the charts that I have made before. All the charts that you have made, will be kept in your account, right? So I'm going to make something like this. So let me show you this chart. This is called an arrow chart. It is not available on Flourish. It is only on Data Wrapper. And in this case, right, if you want to show the difference between the target and the actual situation, right, for four different countries, compared to what I show you just now, okay, I believe most of you would think that this is actually a better chart, right? So you show that this is the target. The target is to reduce by 35%, but what actually happens is that it increased by 3%, right? So for Philippines, it increased by 7%. The target is to decrease by 35. Same goes for Indonesia, 35. But Indonesia was able to make some progress by reducing it by 10%. Pakistan reducing it by 8.7%. It just not just showing you the percentage of reduction, but it also shows the real what do you call it? The real incidence rate, right? Which means still you can see that India still has the highest incident rates for TB, right? Sorry, this is mortality rate for TB, right? And Pakistan has the lowest, is like 20 something compared to among all four countries. Okay, there's a question by Sushmita Panda asks which one is better, Data Wrapper or Flourish. I use both. I won't say which one is better. It depends on what kind of charts you want to make. As I mentioned, if you want to make maps, Data Wrapper has many more templates. If you want to make charts and you want the charts to be interactive, right? That you can hover over, mouse over to see more information. Probably Flourish would be better. So my recommendation is that learn how to use both of them and get familiar with them. And the next time you want to make a chart, you know which one is better, right? Both give you free accounts, so just use them, right? Okay, I hope that answered your questions. So let me do this very quick demonstrations, right? So let me go to dashboard. I'm going to create a new chart. Okay, so it's very easy. I click the chart. So first I need to upload my data. Okay, how do I upload my data? I have to prepare my data. Okay, so you can see that this is the original data. I reformat the data, right? This is for the incidence rate. This is for the mortality rate. Okay, the mortality rate is mortality per 100,000. All right, so this is the mortality rate. So for each country, there are two types of data. One is the actual data. The other one is the target. Okay, and the original data tells me the mortality rate. Okay, in 2015, the first number is 2015, and the second number is the mortality rate in 2020. Okay, and the percentage change of mortality rate. Let me just make it bigger so it's easier to read. Okay, so you can see the change mortality 2.8, 10%, 8, but the target is 35 for all four countries. Okay, but this is what happened in reality. All right, so you can't just copy this data and put into here because data wrapper doesn't recognize this format. And you can see that, there's a merge cell. Merge cells means that, multiple cells are merged and one value is put inside here to represent that, it's the same number for all countries, right? But if you put merge cells in data wrapper, it will not be recognized. So in this case, you need to reformat the data set. So I reformat it to this version. So you can see that it's much easier, right? I have all the 2015 numbers. I have the 2020 numbers. But for the target numbers, right, I used a formula, right? Which means I used 217 times 65%, which means a reduction of 35%, right? So the target is to reduce the mortality rate from 217 to 173.6. This 173.6 is not available in the original data. I have to calculate it. But because I know the percentage of decrease, the WHO target, right, I can calculate it, right? So I just put, for example, I can do this times 0.65, I get the number. Oops, sorry. Right. Yeah, I hope I didn't get this wrong. Okay, but anyway, this is how you reformat the number. After that, what you do is that you just have to copy the data, Control C, copy the data. You can copy it from your Google Sheets, you can copy it from your Excel, or if you're using OpenOffice, you can do that as well. Then you go to data wrapper, paste your data here. Okay, there are actually different ways of putting the data. You can copy paste data, you can upload a Excel file or a CSV file. You can connect to a Google Sheets, like that is my Google Sheet. I can also connect to the Google Sheets, right? But the easiest way, I think, is just copy and paste. Okay, then click proceed. So now you have to check and describe your data. So it tells you that if the data is a number, it should appear in blue color. If there are text, then it should be in black color. If there are dates, right? If you have dates, right, then it should be in green color. I don't have dates here. And if it is in red color, which means there is a problem. So when you look at all my data, they are either in blue or black, which means there's no problem. All right, done. Then we just have to click proceed. You can also change the language if you want. They support multiple languages. Now, this is where you're able to pick the type of chart that you want to use to represent your data. So I know that I want to make arrow plot because that is the best chart, to illustrate the gap between target and the reality, and it works, it works for multiple countries. So I'm going to click arrow plot, and it will show you that okay, this is how it looks like. India, Philippines, Indonesia, Pakistan. We know that one of them is the actual, one of them is target. We can further customize it later, right? We just have to click on refine. This is where it allows you to customize your chart, right? Okay, so arrow start, 2015 correct, and at 2020 correct. Labels, country. Labels means that the labels here is countries. I'm going to change it to category. Remember my data? Category is actual or target, and the country is here, right? So different. I'm going to change it, the label change to category, so that now it is showing actual and target, right? For different countries. But how do I add in the countries, right? I can go to the last here, the last option here, which there's an option called group bars by color. Okay, so now I can group the bars by country. I can choose country or categories, but if I choose category, you see that what happened is that it will become all actual and all target. That doesn't make sense, right? So I'm going to change to country. Yep, and now I have different countries and the actual and the target number, all right? Oh, guys, I know what happened. I'm not using the mortality rate data. I'm sorry about that. I'm using the incidence rate data. So let's say I want to change the mortality data, right? I need to change the mortality data. It's very easy. I can I'm halfway designing, right? Then I realize that, oh, I actually put in the wrong data. So what do? I can just go back to upload data. Then I can just copy my data here. This is the mortality rates. I want to make this, not this one. And I just can remove the data, delete it, and paste the new data, and I click proceed. You see, it's as simple as that. If you want to update your data, you do the same thing. You see, now I have these two different arrows, right? This is the mortality rate, not the incidence rate. Okay, so I want to differentiate between actual and target. I can color them differently by customizing under appearance. Okay, so I can do color key. No, actually not color key. Customize colors. I want to customize based on category. For actual, I'm going to put red color. From target, I'm going to put blue color. And then, oops, this one should be red color. Okay, this one should be blue color. Oh, now you see that my arrows are in, for the actual, are in red, right? So this is how you can do it. You can also put a color key here if you want, like red means actual, blue means target. I think it's not necessary here because I have the label here, right? So I don't need that. What happened is that this is percentage, right? So this is percentage, okay? So I will have to go and change it to percentage, which means the number format. I'm going to change it to percent. Let me see if it works. Yep, it works. Okay. And the show value, right? This is actually not the percentage value. This is actually the actual mortality rates, right? So actually, I shouldn't do that, right? I will have to change this label to percentage first. How do you do that? You can see that show values. If you hide the values, then there's no value. If you show values, you can choose whether you want to show the starting value or the ending value, or both starting and ending. Or you want to show the percentage of change. This is what I want to show, percentage of change, right? And now I can change the number format to percentage. No, not this one, sorry. It should be the other one here. Change it to percentage. No. No, I don't have to change it, sorry. It's already in percentage, sorry. That's a mistake. Yep, so this shows the absolute number of mortality rate. This shows the change in percentage, right? So done. Anything else I want to change? I can make the arrows thicker if I want, okay? And after that, I'll just have to go to Annotate. Annotate is, this is where you can put the title, right? I can put like 4 countries, Miss WHO 2020 target TB reduction, for example, right? Descriptions, I'm going to show that starting, I'm going to like help people understand my chart. Starting point of each arrows indicates value in 2020, while ending point indicates 2020. The first one should be 2015, right? And then not value, but I'm going to put mortality rates, right, per 100,000. So it depends on how you want to put it. I just put it like that. You can put data source. I still remember my data source is from Global Tuberculosis Report. If you have a link that you want to link to your data source, you can put in the link. If you want to put a byline, who made it, I'm going to put King, right? And you can also highlight elements. Yeah, I don't want to do that. One thing I missed just now was I want to show the year in like this, showing that this is 2015 and 2020. I can do that by clicking label first arrow. So now you see that this is 2015, this is 2020, right? It only labels the first arrow. So it helps readers to understand that, oh, this is how you read the arrows. All right. So let's say once I'm done, I can also change the layout if I want. If you want to let readers download the data, you can have the link here, get the data. If you don't want to share your data, you can disable it. I always encourage journalists to share data. Okay. If you want them to share this chart on social media, you can add the social media button here. Okay. So that's optional. All right, you can also change the size and you can also test it how it appears on different screens. This is mobile responsive, which means it appears differently on different screens. This is on mobile screen. This is on probably tablet. This is on desktop. Okay, and there are other options that you can try. I'm not going to show everything here. Just the basic steps to make a chart, and you can click publish and embed, the last step. So here, there are two ways that you can publish it. One, you have to click publish first. Okay, publish. Now it's live. Okay, now it's live. There's a link for you to open the chart. This is good when you want to share it with your editors, with your colleagues, to show them that, hey, this is the chart I made. Have a look. Tell me if there's anything I should change. Okay. But if you want to publish it, one way, of course, you can download it as a image file. Okay, I'm going to show you how it looks like. This is how it looks like here. Okay, this is an image file in PNG format. Or if you want to embed it in your website, right, you can do the embed code. Okay, this is the iframe. You copy this code and put into your own CMS or your own publishing platform. If you are using a WordPress, you can do that, right? Okay, and you will get this chart in your story, right? Then you don't have to. And then it is the difference between embedding a chart and to put it as a graphic file like this is that embedding a chart makes it responsive, which means that it appears differently on different screen. Like you can, it looks like this on mobile, it looks like this on desktop. But if you publish it as an image file, you know that it's fixed. You can't do anything with that, right? So if you're able to embed it, just embed it. Embedding is the better option. If you're not sure, like how do I use this code, right? Get in touch with your IT manager. They will figure it out. This is just like you embed a YouTube video in your article, or you embed a tweet, in your article. This is the same way. It is called a iframe. Okay, responsive iframe. So just copy this link and put into your publishing platform, and you should be able to get exactly this chart in your story when you publish it. Anytime when you want to update the charts, you just have to come back, log in back into your dashboard. Okay. You want to change your data, you can go back to your data here. You can change some numbers here. Okay. After you change it, go back to publish and embed and click republish. And the chart that has been embedded on your article will be automatically updated when you click republish. Okay. So if you embed these charts in, say, more than one story, right? If you click republish here, then all the stories that have this embedded chart will be updated. So you don't have to go through them like one by one. You just have to update, the chart on data wrapper. So this is how you can do it. All right. There's one question from Pauline. Hi, Pauline. Yeah, good to see you here. Did I get the data? No, I didn't get. I don't just glean it from the report. I actually get from the publisher. Yeah. I actually try to contact them and to tell them that, hey, I want to use this. I want to use this for this workshop. Can I have the raw data that you're using? I always ask for raw data if possible, right? Because who knows, right? They might give you more data, okay, to work on that. So this data, this report, just want to highlight that this report also talk about what are the factors that causing, all these problems. And they talk about the gaps in healthcare treatment, in diagnosis, right? So from here, this report, if you really want to do more further reporting, you can, make it even more relevant by using local data. So I believe if you go to, your local health ministry, they would have data about the provinces, the states, the districts, the counties in your country. And, using those data, you're able to, make a more relevant story to your readers. Remember, all the different techniques that I showed you, right? Personalization, humanizing, using the data to show a bigger picture and things like that. All right. So before we end, let me just share with you the slides. I have compiled some data-driven health reporting that might inspire you for your next reporting. All right. There are some stories from BBC, The Guardian, Infographica, Amazonia in Brazil, two stories from ProPublica, right? Yeah. So I think for those beginners in data journalism, usually, the easiest way is to copy or replicate methodology or approach used by other data stories for your local market, right? So is also how I started. When I first started as doing my data stories, I always look at others and think, can I use this method or this kind of data visualization for my own market or for my own country, right? So looking at more reports out there, especially the good one, will help you to think more creatively about your own reporting. All right. So before I end in the slides, there are also other data visualization tools, right, that you can use. All their links are in the PDF that I share with you. Explore them. All of them are free and they don't need any coding skill. Okay. So yep, that's it for my presentation today. I hope you have learned something. If you have any questions, I'm happy to answer them. I think we still have about 2 or 3 minutes. And feel free to contact me if you need any help, right? My email is here. So any questions in the chat box? Any feedback? Okay, if there's no, then thank you so much. And I'll pass the session back to Jen. Thank you.
Sorry, there's one question. What if you couldn't get any data from the organizers? They did not respond to your request. Are you able to? Is it all right to repurpose? In other words, clean the data and then rework it into a report? I mean, is it appropriate? That's my question.
Yes, it is appropriate to just get the data from the report. Since the report is public, right? It is for public consumption, so there's no wrong. You treat it like a press release, right? They publish it, so you can quote the report and you can make your own, you can make further reporting or you can make further analysis. But my advice is always to get in touch with the data owners or the managers, because who knows, there might be some things that, very, very important for your further reporting, but they are not stated in the report. So, you don't want to make assumptions that are not accurate, which might be misleading to a reader. So I always advise that get in touch. And usually when, if the publisher, they publish the reports, they want to let more people read the report, right? They usually are happy to help you if you want to further distribute the information or you want to do further reporting, right? Especially academics, right? This is not something that is like super sensitive. When it comes to health reporting, usually the journalists are more aligned with the researchers and academics. So in this case, I think you should always reach out. If you really can't do that, then yeah, it's okay to quote the report, but make sure you be very careful.